international journey that shaped both my education and my professional path in public health. I've lived, studied, and worked in Australia, Singapore, Denmark, the UK, and the US, gaining academic and professional experience in each place. I first came to Hawaii in 2010, and very soon after got into outrigger canoe paddling, an activity that became very central to my life. Today, I consider Hawaii my home, knowing I will always be a guest on this Aina, acknowledging that this is indigenous land wrongfully taken from Kanaka Maoli. After Germany, it's where I've lived the longest, and more importantly, it's where I'm raising my family in the Ka'ilipule area. Hawaii and its people have deeply shaped how I live and work. Next slide, please. Coming back to cultural and regional relevant physical activity, I want to highlight two areas of work where my team and I within the Public Health Resonance Group have focused on. It's knowledge that is deeply rooted and well understood by Native Hawaiians and Pacific Island communities, but where the Western science has to catch up. Hula is the most recognized example, thanks to Mililook and her team, which most research exists supporting its health benefits, but evidence remains limited for the other activities. My team and I have approached this through two complementary strategies, qualitative and quantitative research. We have started with listening to community voices and the lived experience, values, and meaning attached to these activities. This also connects to what Micah Thompson presented in the childhood panel. If you could click on it once. As such, the data you can see now, some quotes that we saw across, for example, from a paddler, a hula dancer, a surfer, and a spearfisher. And when we tried to code that qualitative data, we couldn't necessarily put it in the existing social ecological model that you can see on the bottom from left to right, because it typically finishes at the macro social factor level. But our team added the spiritual factors. And if you could click one time on it, adding that level, you could it also actually it made sense because looking at many indigenous frameworks across the globe, spirituality is a central topic. Next slide, please. This is therefore the adapted framework that we are using. This is also a way that data can be visualized because it could be turned into heat wheels. Next slide, please. To add to the quantitative data, we as a group, as Access Meds, a group of researchers whose mission it is to make meds, metabolic equivalents, accessible for people with and without disabilities, and to strengthen the evidence for culturally relevant activities in Hawaii. We think as Access Meds project as an innovative use for outrigger canoe paddling, next slide please, to promote health outcomes across populations. Next slide please. The community named this project Iho no Ka Epikema, Paddle for Science. We found that outrigger canoe paddling for OC6 is a moderate to vigorous physical activity for people with and without spinal cord injuries. Access Meds provides an example and highlights the importance of consideration in building science around physical activity for those with and without disabilities. Adaptive and non-adaptive paddling can and should be used within the strength-based physical activity promotion in Hawaii and beyond. We had very high community involvement. We worked with a local canoe club, a local organization called Access Surf Hawaii, and this study was done from paddlers, with paddlers, and for paddlers. Next slide, please. In addition to that, we are trying different feasibility studies and a survey as a pilot for data, but we also now are testing a paddle adapter V1 and OC1 that we recently added. Next slide, please. In terms of next steps, we have to publish those data so that everybody can use it, analyze the paddle for single canoe, and think about an intervention or programming. We are excited that we have all the new partners who are interested in this work, but if you are also, please let me know. We've also worked on the MedQuest waiver, which is the Hawaii Medicare program, to add other Native Hawaiian healing activities. And as such, hula has been recently added, but we have a long way to go to get other activities like paddlings added too. It also depends where potentially my professional home is. And next slide, please. Here's my email and a couple of QR codes in case you want to collaborate with us.